Hello, this is Dr. Do again. This video is still on alphabetic list of problems on letter S. Today I'm going to talk about the very common conditions, shoulder pains. Shoulder pain actually, especially for young adult, middle-aged, or advanced-aged adult, it's quite common because this shoulder joint is one of the most complicated joints in the body. And also, there's so many causes, either acute or chronic, the impact is really can sometimes severe to impair the functions because limited range of motion and any movement of the shoulder will cause the pain. So that's why I'm going to talk about the shoulder pain. First of all, let me just bring up the emergency situation associated with shoulder pain. Of course, acute injury may just the muscle strain or fracture or the dislocation. So these are the emergency situation. You have to probably caused by the fall, falling, stretch the arm or any kind of injury, or the dislocation by pulling too hard. So if that's the case, you really need to see the emergency. Or if the shoulder pain associated with neurological problem, like a lack of movement, cannot move or feel numbness, tingling persistently. If that's the case, you need to, even though maybe it's not emergency but urgent, to talk to your physician. The sooner the better, because that sometimes the radiculopathy can cause this shoulder pain. So this is about the emergency situation. Can you manage at home? Probably for the minor, we all have here or there, sometimes like the Saturday night party, you stretch your arm for a long time, the shoulder pain, you probably manage at home, use some Tylenol or Motrin. But the point is, if the shoulder pain is persistent, cannot feel better with medications, you probably need to see a physician to discuss and to make sure catch it on the acute phase to treat it. But usually, regardless, if the acute phase, still anti-inflammatory medication is the choice. So Motrin or some of the strong medications from prescription, so that probably help. So anyway, this is about the emergency and other minor situation managed at home. But in general, for the children, the shoulder pain usually caused by the trauma. So that's probably either pulling too much or fall. So that's one of the cause. That's definitely the emergency. For the young adult, of course, injury. It's from sport or particularly lifting frequently or bump the head. So if that's the case, you cause shoulder pain, you probably need to see a physician. There's some inflammation or chronic tone unhealed. So if that's the case, you need to see the emergency. That's for the young people. Probably the joint is the glenohumeral joint is the one of the common injured site for the shoulder pain. For the late adult or middle adult, the same thing. Usually it's caused by the impingement of the shoulders. Frequently use it or degenerative or infection or cause this shoulder pain. It could be the same thing, the glenohumeral joint, or could be other joints like the clavicle, scapular, or other joint. So if that's the case, or the calf, the rotator cuff, I think I mentioned it before. The rotator cuff is the one who really play major role in the shoulder movement. So the chronic rotator cuff injury is quite common, either from sport or from your daily life. You just pull too much or lift the weight too much. So if that's the case, you can manage at home, use some anti-inflammatory or massage. But usually, I think the best way is to see your physician probably still the management is anti-inflammatory or the massage chiropractic to treat, but still you're doing it under the medical guidance, the physician or your practitioner to massage to help you kind of rehabilitate it, to make it heal better. And if severe cases, maybe the injection, local injection of steroids may help to improve the symptoms. So this is for the older people, elderly, the shoulder pain. If the elderly female, for example, osteoporosis and after the fall, so that probably cannot exclude the fracture, so you have to see the emergency as soon as possible. For the older people, the shoulder pain is quite common, either rotator cuff or the joint undergoing degenerative change. So the management is still anti-inflammatory, or the massage, physical therapy, or the steroids. But the key point for older people, even though the anti-inflammatory medications, is still need to adjust those compared to the young people, because the older people, the kidney function is not as well as young person, and also a lot of anti-inflammatory medications metabolize through the kidney, so that still need to be managed by the physician. So shoulder pain is so common. I think many causes, in addition to the acute injury or chronic worn out, or even a position, if you sit or so long, or if you raise your arm so long time, then can cause it. The other important cause and quite dangerous of this shoulder pain is the cervical radiculopathy. If that's the case, really, I think need to see a physician to diagnose. Probably the treatment is surgical. And for any kind of shoulder pain, chronic, if the conservative management, if the anti-inflammatory or physical therapy cannot make you feel better, or there's no improvement after weeks of treatment, then probably consider the injection or the surgical treatment, to do the surgery to get rid of the scraping off the inflammatory tissue, and to if it is a torn, particularly if a chronic torn, so then we need to put them together. So this is about the shoulder pain. It's quite common. It's so many causes, and the shoulder, like I said, one of the most complicated joint. So the take-home message for this video is, if you have shoulder pain, long-lasting, see your physician, and the physician will check your range of motion and X-ray or imaging study to diagnose exactly location, what is exactly joint to cause the pain, because the shoulder has at least 3 or 4 joints, and also the thick fibrous tissue, the disc around it. So then if that's the case, then you need to see a physician to get diagnosed and get the treatment accordingly. So this is about the shoulder pain, and I'm going to stop here today, and hope it helps. And thank you for watching. I will see you next time.